Okay, I have to apologise. We did make a team video, but we ended up talking for 2 hours. So I'm just going to summarise. Teachers with COVID UK is a Facebook support group which I set up in September last year because I was a teacher with COVID and I was struggling with a lot of very school-related issues that I wasn't seeing addressed in the other support groups. So I thought I really was trying to find answers to a lot of questions and I couldn't find them anywhere. So I set up this Facebook support group and it turned into a place where I could get the answers I needed, and so are lots of other people. So it's been a really positive experience, especially people like me that caught COVID in the first wave and are still suffering with symptoms, really debilitating symptoms. The support group has actually been more helpful than our employers, our advisors, our unions, our doctors, everyone, because it was new and no one knew what was going on.
I'm just in pain. I'm thinking about whether I'm going to have some more morphine at the moment. I've been taking everything, all these sorts of nerve pains, because I have post-COVID neuralgia along with fatigue. So it's a daily reality for me.
Just had excruciating torturous pain that just went on day after day after day. I couldn't lift my arms, couldn't open my hands. I could just breathe. And at that stage, I had the guilt, but I couldn't remember my headmaster's name. I couldn't remember any of the children's names in my form. I couldn't remember any of the names of the people I worked with. My whole memory had gone. If I wanted to lift my hand, I could put it against the wall and use my fingers to crawl up the wall. And then I could teach my daughter how to sort of chop the vegetables, things I couldn't chop a tomato. So got her training her how to help me around the home. And she was pretty much, I mean, it was neglect really for her. You know, nobody at the school stepped in to sort of, you know, to help get her to key workers, because I couldn't look after her at home at all. You know, I really needed, I just dreamt of being in a care home. I really just dreamt and wished somebody would just say, look, we'll take you to a care home. And then I just wanted to be looked after. I thought that was it. I didn't think, I got to the point where I thought that this is where I'm going to be now. And then I obviously, the impact on my family has just been horrific. My daughter not doing anything herself and having to be my carer.
Often schools like mine, which are over 1,000 pupils, about 200 staff, you know, there's a lot of people moving around at the same time. We're all very close together.
We got given a visor and we got told we had to wear them during busy periods. But like since I've been back to school, I am the only one that wears a mask in assembly. So we've got all of the primary kids, all of the primary staff in one hall, and I'm the only one in there that wears a mask.
I'm very concerned about the young people. We know that about 7% of children who get COVID will then go on to develop symptoms lasting for longer than 3 months. And these are often very serious, very debilitating. I'm reading about young people with lung fibrosis, with heart issues, with all sorts of things, as well as obviously the impact on their lives for being so ill for so long.
And to actually put people's health and livelihood ahead, because okay, they're talking about the economy, but if all us key workers as teachers think of the years of training and expertise that we all have collectively, you're talking about over 100,000 different members of staff just in teaching, and think of all the years of training and expertise that's going out the window at the moment because we're all ill with long COVID. I think to prevent it, they need to act more quickly and be a lot more precautious.
So children are suffering, families are suffering, school staff are suffering, and it's been an extremely stressful year, and I just see it all happening all over again. No one seems to have learned anything. So yes, we're very keen to do what we can to prevent this happening again, and more immediately just try and minimise any more impact from this horrible disease on our communities.